but you're not going to learn breathing from it. You're going to learn breathing from what I just did, from taking the exercises. I have a 12-foot long strap that I show people how to wrap around their chest and then tighten it and lock it in place and then breathe in and release, and the tension backs off and the chest gets bigger. It's within, most people within minutes. Some people have to work on a long time in order to make that happen. Stockbrokers, one class. They're a little tight sometimes, you know?
No.
Yes?
What do you think about CPAP machines?
About what?
The CPAP machines, the breathing machines?
I don't like them. I don't like them because if you break a leg and you wear a crutch and then your leg heals and you keep the crutch, what's going to happen to the right side of your body? It's going to stay weak, isn't it? The CPAP is an emergency tool. The head of the sleep labs was a professor at Stanford. I was in Berkeley. He was in Stanford. And I learned a lot about him from his students coming up asking questions. So the CPAP is a mechanical breathing device. And some people like it. Very few people like it, but some people do. I leave them alone. Fine, you like that. Well, what's going on is you're going to become more and more and more dependent on that because your whole system is going to weaken because it's not being used normally. So what I do with people is redevelop their breathing. And that quite often gets them either more effect from the CPAP, or it gets them away from using it altogether, or needing it altogether. And I've had people travel. People say you need to have a certain amount of commitment to do this. This is not little something where you go to the doctor, he gives you a prescription, you stick it in your mouth, and everything works right. I mean, I work people. They come to me, I work them. But I do it in a way that's very intuitive and very methodical and usually very effective. So, yeah, apnea, and they're putting 7-year-olds on CPAPs now. What's wrong with this picture? They need to teach the children how to breathe. The first thing they should do is get them in a singing class. Let them start singing. When I was a kid, I got abused a lot as a child. My mother caught my father when I was 2, terrorizing me with a vacuum cleaner. What are you doing? I'm going to make a man out of him. Yeah, what, a vacuum cleaner salesman? You know? And then at 7, my grandmother beat me with a razor strap a lot for coming the wrong way from a Sunday school, you know. Age 11, I got into a school, and my 5th grade teacher got us up and had us sing every day for 45 minutes. I transformed from a frightened child to singing a cappella for the school, starring in the class play. And I had a girlfriend who was a year older than me, an older woman at age 11. It's a big deal. So I transformed. That was a huge transformation. So getting children to sing is absolutely, and the worst thing you can do to a child when they're singing is say, well, that was awful, or make it sound awful, because your voice is your second face. You do not insult someone's face. Your voice is your second face. So, got off camera. Hi, guy. So anyway, that's any other questions?
In your experience, have you seen RBC count affect breathing?
So what?
In your experience, have you seen RBC count affect breathing?
RBC?
Red blood cell count.
Oh. Actually, one of my products increases red blood cells, and so yeah, it should make it easier and more effective. What it does to the pattern is kind of relaxing.
What product is it? What product are you talking about?
It's called E3 Live. It's one of the blue-green algaes. It's full of chlorophyll. It's got 3 to 5 times the live chlorophyll of wheatgrass. So the chlorophyll acts as an oxygen transport. It works great. I've taken type 2 diabetes, given fruit smoothies, and given E3, and no spike. Works. Again, I have to go out there because when they come to me from wherever, you know, they need to find out what works. And so to give them things that don't work, to me, is cruelty. I got a huge thrill out of getting results. I just get thrilled, you know. Yes! You know? So, or maybe not in front of them sometimes, but, you know, it depends. So anyway, any more questions?
So you mentioned sleep apnea.
Yeah.
You have breathing techniques to help with the sleep apnea?
Well, sure. Yeah, in other words, one of my faculty members is a dentist. And so his approach, he came to work with me because he wanted to get breathing insights. And one of his opinions is that that apnea is about 70% jaw-tongue relationships. Well, okay. So I, pardon the pun, bite into that as much as I possibly can by using vocalizing techniques, by using operatic training techniques. So we swallow our pride and eat our words. Tongue goes back in the throat. This is going to help invite, right? Okay, so how do you do that? How do you offset that? All right, well, I have lots of techniques for that. You know, so how successful it's going to be, I don't know. Quite often it is totally successful, and quite often it's an improvement. And so then with some others we need longer. It's not going to happen in 3, 4, 5 days. We need longer. We need to come back and do it again. So sometimes I Skype with the distance people, you know, or sometimes they just come back. I have a fellow referred to me by an MD from Aiken, South Carolina. He's coming back tomorrow. Changed his life. So the MD says, go see him. You know, and he was with me for 3 days, for about 18 hours. You know, so yes, you can't just tell somebody. You have to retrain. It has to be reorganized so that the deep and superficial fascia, your connective tissue, get in the right way. I might send them to a body worker. One of my body workers works on Cam Newton and Thomas Davis. Do you know who they are? Cam Newton, quarterback for the Panthers. Thomas Davis was Man of the Year at the Super Bowl. She works on him. She works on me. And I've had probably 250 bodywork sessions. I know what's good. When they put their hands on me, I know they know what they're doing or not. So this is my little team. And sometimes I will send them out to a chiropractor. I need x-rays. I'm not sure about this guy walking in like this, and I have to do some techniques on him that might release some spurring in the spine and put him in agony. I don't want to do that. You know, so I'll take him and maybe there'll be a program that I like that I get him into at this place that I take him to. It's just whatever works. I'm not trying to be the all to be all, but I am where the buck stops. So I act more like a case manager a lot of times, where people will come in because I've been studying this stuff and studying alternative health since the 70s. So, and I used to live in Marin County, which is like Mecca for personal growth. So that's kind of where, that's my history. Okay. So anything else? Any more questions? All right. Well, again, thank you.
Thank you.